The U.S. government shutdown, now in its fourth week, is having increasingly serious consequences for American citizens, the economy, and federal services. Because Congress has failed to pass the necessary appropriations for fiscal 2026 funding, many federal agencies have been forced to halt non-essential operations. Hundreds of federal employees have either been furloughed, meaning sent home, or are working without pay. The economy cost adds up quickly. Some analysts estimate the shutdown is costing the U.S. economy around $7 billion per week, with some estimates as high as $15 billion per week in lost GDP if the shutdown persists. The longer it goes, the more likely private sector ripple effects become. Lost consumer spending by fall of the workers, delayed contracts and purchases by the government, reduced confidence in financial markets, and delayed economic data. The immediate human cost is substantial. Federal workers whose paychecks are delayed still have bills, mortgages, childcare, and basic expenses. Their reduced spending has knocked on effects in local economies, especially around Washington, D.C., where a large share of the federal workforce lives. Some have started using savings or relying on outside assistance to make ends meet. While mandatory spending programs like Social Security and Medicaid continue since they are funded outside the immediate appropriations process, many discretionary programs are impacted. For example, benefit verifications, consumer service, records updates as Social Security may be slowed. Agencies in areas such as health, research, environment, immigration, and food services are reducing or stopping operations. For example, the Food and Drug Administration and Centers of Disease Control and Prevention are operating with minimal staff. Travel, airports, and transportation infrastructure are under strain. Although key personnel like air traffic controllers and Transportation Security Administration agents remain working, they are unpaid and service disruptions or delays in training are as expected. States and localities that rely on federal funding may face budget uncertainty as federal payments are delayed or become unpredictable. Programs such as food aid, like the Supplemental Nutrition Assistance Program, could be jeopardized if contingency funds run out, placing vulnerable populations at risk. Additionally, national parks and cultural institutions may reduce services or close certain localities because their staffing or maintenance budgets are impacted. Even once the shutdown ends, there will be lasting effects. Research projects, environmental oversight, infrastructure maintenance, and federal contracts delayed during the shutdown may not be fully recovered. Also, the uncertainty undermines public confidence, the stability of financial markets, and may influence decisions by business who depend on federal contracts or timetables. For U.S. citizens, the ongoing shutdown means less reliable government services, delayed pay for their workers, potential disruptions to programs people rely on, slower economic growth, and increased uncertainty about the future. The longer the shutdown drags on, the greater the risk that mitigation becomes harder and damage more lasting.